Medicine is so fragmented. Medicine is so fragmented. You know, I don't think it can be fixed. I see people talking about Medicare for all. I think it sounds good on paper. Obviously, I think it would draw a lot of voters into people's circle. But the truth is, I just don't think it's possible. And I'll give you my reasoning. Medicine is just a very fragmented beast. It's so fragmented, and that's sort of by necessity. You know, there are some organizations that have done a good job of kind of integrating a healthcare system. Integrating insurance, and then the physical buildings of hospitals and clinics, and then the employment of staff, nurses, technologists, also physicians who are then employees of the system. And there's definitely, here in California, there is a system that does a very good job of integrating that all together and having everything accessible across the different sites and kind of creating that holistic whole healthcare. That being said, there are people that like that system, and there are people that still want a private system where they have a choice, where they can go to see the specialist that they want, the physician that they want to have a relationship they can go see. And they want that freedom. They don't want to be bound to a certain healthcare organization or system. In my work, work is very fragmented. It's fragmented, but there are inherent relationships. There's nephrology groups that work closely with the radiology group, but that's an outside office. We work out of a hospital. The major form of communication is faxes, stacks of paper, phone calls, phone call from one office assistant to our office assistant for scheduling, faxing of insurance documents. Somehow it works. We get the patients on the table. We have a system for evaluating the patient, evaluating the safety of the procedure, and it sort of works out. Certainly a couple things are missing, or maybe they're just not the same as where I've seen in other institutions, but it ends up working out. There's language barriers. A lot of the patients with end-stage renal disease tend to be Spanish speaking. I don't speak Spanish. We have access to interpreters. A lot of the staff speak Spanish, and some of the patients' family members speak English and Spanish. But somehow between all of that, it sort of works out. Fragmentation is good and bad. It's bad in the sense that we're not having a real true communication between all the different providers, at least on paper or in a computer form. I can't just check into a patient on a computer and see everything that's happened to them over the last 6 months in terms of medical care. I can't see all their visits. I can't see all their labs. I can't see all the imaging studies or the previous places where they've had procedures performed, stents placed, or I can't tell the last time that they had this study necessarily, unless they came back to our place. But there are some good things. I'm sort of losing track of what I was trying to say here. I guess what I'm trying to say is that fragmentation is good in the sense that it gives people choices. This actually happens sometimes. Sometimes a patient will go to a purely outpatient facility to get their care of their dialysis access, but sometimes that place is not available or not open or not accepting patients. Oftentimes this is at the end of the day, 4 or 5 o'clock on a Friday. They may not be interested in taking care of that patient. The hospital is still somewhat interested in taking care of that patient in the sense that we can have the patient come in, we can place a temporary catheter, and we can take care of that patient maybe the next Monday, or sometimes we just stay late and squeeze it in and do it. That comes because we have a choice. That comes because, in a sense, we're competing with that other organization. They are looking for outpatient work. We are looking for outpatient and inpatient work. And we have a little bit more resources because we're a hospital. They have slightly less resources because they are an outpatient clinic. Those people might be making more. They might be making more in terms of their earnings. We might be making less, so we might have less risk, I guess. I'm not personally invested in the business as they may be, and that kind of changes things.